When every minute counts, you need an expert partner by your side to guide you through a cardiac emergency with a simple, step-by-step process. Adaptive instructions and intelligent sensors keep you on track to deliver the therapy and bridge the gap until care arrives. Act quickly and confidently with Philips AEDs, your partner in the shared mission of helping to save lives. To begin, simply open the AED by pulling this lever down. The device will turn on automatically.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
Then, just follow the clear and calm voice instructions.
Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
The HeartStart OnSite walks you through the entire rescue process and lets you do it at your own pace. Once the pads are on the victim, the system itself will analyze the victim's heart rhythm and tell you when to deliver shock, if and only if the victim actually needs it.
Shock not advised. If needed, begin CPR.
And it even guides you through CPR. It's just that easy. Maintaining a Philips OnSite AED is easy too. Each system comes with a simple maintenance sticker to keep track of the two accessories, the pads and the battery, that will eventually need to be replaced. On this sticker, write down the key dates for your accessories, the install-by date for your spare battery, and your expiration date for the pads. When it comes time to replace the battery and pads, all you need to do is pop out the old battery, slip in the new battery, slide this lever to pop out the old pads cartridge, and drop in the new pads cartridge. Each HS1 AED does its own self-testing every day. All you need to do is make sure this green light is blinking. Act quickly and confidently with Philips AEDs, partnering with you in the shared mission of helping to save lives. Innovation and you, Philips.